Well, yeah, before the pandemic of COVID-19 in Kano State has one of the robust health sector. We have a lot of the, more than half of the wards with functional primary PHC, primary healthcare center. We have general hospitals that have been upgraded. We have one in Doakin-Tofa, we have one in Gorozu. These are all smaller hospitals that have been upgraded to general hospital. We have additional of two major hospitals, the Muhammad Buhari Specialist Hospital and in Gigenyu, and Khalifa Isiaka Rabiu Pediatric Hospital at Zoo Road, which are all new hospitals that have been added to provide to increase the access to healthcare at the secondary level and even the tertiary level. So a lot of effort has been put in place in terms of addressing healthcare challenges in the state. So it's just this is a pandemic that nobody has prepared for. So it was something that that the state government is trying its best. Even in this one, we have some isolation centers that are being used and put in place to address the issue. In preparation, I think Kano State is one of the best because we have done a number of things that have shown that the state government was very prepared in terms of addressing or heading on the pandemic head-on. Even before the outbreak, a number of measures have been taking place, and that is where the state government put lots of resources into. Like I mentioned earlier, the issue of the isolation centers. You know, we've seen the Konodoaki Isolation Center, which has about 70 beds and 27 ventilators, which is one of the state-owned centers with the highest number of ventilators in the country. We have seen the conversion of Muhammad Buhari Specialist Hospital into an isolation center so that they can separate the cases from mild or no symptoms cases to severe and critical symptoms cases. So this is what we have done in that regard. Also, palliatives is very, very crucial in this particular situation. Because of the lockdown, because of the downturn in economic activities, a lot of people, particularly Kano, that has about 70% of its population that need to go out daily to get what they will eat. So palliatives is very, very crucial so that you can maintain law and order, you can be able to feed people so that they will not be dying of hunger instead of COVID-19. So palliatives, our 800 million naira was put into palliatives. I think 600 million of that was a donation received in cash and in goods, while the state government added about 200 million to address that. The only place that I would say we are having challenges is the issue of testing, which is primarily the responsibility of NCDC. We took a while, calling the attention of the NCDC to establish the test center in the state. We all recall that prior to the establishment of the one in Kano, there are about almost 10 testing facilities in the southern part of the country, but there was not a single one in northern part of the country. Whereas at the moment, I think the state government is on top of the situation, and it has reached out to a number of other partners, stakeholders, like World Health Organization, National Center for Disease Control, and the African Center for Disease Control as well, and other partners to try and, first of all, ascertain the true causes of the death. But like we have heard, particularly from the Ministry of Health and other stakeholders, it's not really, so far it's not really COVID-19 related, because though they have taken samples of some of the corpses that have died before burial, and they are also conducting verbal autopsy to try and ascertain the history, the health, ailment history of the people that died so far. But preliminary results shows that a lot of them are people that are suffering from diabetes, hypertension, and so on and so forth. We also have people that, we also have an outbreak of meningitis, and of course it's the season of malaria in the state. So these are some of the explanations that we have at the moment. But it's most important to know that even one of the things that we realize is that due to the lockdown, a lot of people, particularly those in this category, those that are suffering from diabetes and hypertension that need utmost care are not having access to medical facilities. Some of the private hospitals have shut down. Even the public hospitals, some of the patient, health personnel are finding it difficult to transport themselves to their hospitals. So the state government is trying to see how it can give access, make sure that all health facilities in the state are up and running to attend to patients. How